I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. We have a fantastic guest today, Carol Price Guthrie. Welcome, Carol.
Thank you.
So, Carol, tell us what you do in this field.
Currently, I work with StationMD, and we're a medical telehealth company that provides medical services to people with IDD solely.
Okay, so how did you come to work in this company? What's your background?
My background is a long history with IDD. I've been in this field about 35 years. I started as direct care. I've done provider work. I've owned case management agencies. I've done MCO work. So I've been in this field a very long time.
That's a very diverse group of activities that you've been involved in, for sure. So, but you mentioned that you started as a direct support professional. Is that right?
I did. I started as a direct support professional, and of course, I don't know what they were called back.
Yeah, they weren't called that back then.
No, they weren't.
There's lots of different
exactly
terms,
right.
But the current term is direct support professional for the most part. Yes,
it is,
that we
and
hear.
so I started as a teenager with Holston Home for Children, and they had a faction that was specifically IDD, and I worked there for a pastor friend who brought me into that program, and it grew. I stayed there throughout my college years, so I would come home on weekends, holidays, summers, and work at Bewley Center, and so that's really where it started.
So let's get personal here.
Okay.
How did that shape your life?
It shaped my life because I thought that I wanted to be an attorney, and I started on that path even through school. But as I worked through Bewley Center, I changed to social services, and that's how I ended in working with IDD.
Wow. So your next venture after that was what?
My next venture after Bewley Center was Greene County Skills, which was in my hometown of Greenville, Tennessee. I've always lived in Tennessee.
Okay.
So that was my next venture. So it was still direct support work. I went to Sertoma Center and worked as a manager at Sertoma Center for years. I left Sertoma Center, started a program for Department of Children's Services that worked with IDD and people who were non-disabled.
So what type of program was that?
It was with the Community Services Agency, and we provided placement and wraparound services for children who came into into the Department of Children's Services care. So I was responsible for all things DCS and placement for those children, including wraparound services.
That's probably exciting and probably a little scary at the same time.
Very scary, very exciting. I was very committed to that work.
Yeah.
Thought that I would do it until I retired. And my husband was transferred to Nashville to work there. And
Is he a musician?
My husband, well, funny you ask. Funny you ask. He is not a musician by trade, but he is a musician.
Well,
so
great,
am I.
great. I'm not a musician by trade either, but I'm a musician on the side for fun.
Same.
So,
Me too.
Yeah,
I'm a trained classical vocalist.
We have that in common.
Do we?
Yes, I have quite a bit of college classical vocal training.
Same.
Mm-hmm.
We'll have to do something
We should get together.
We should get together. That would be fantastic.
That'd be wonderful.
That would be fantastic. Yeah. My husband is IT, and
okay.
so he was brought to Nashville to work. And so when he decided to move to Nashville, our son was young, and so I didn't work at all for a little while. But went right
That's
back
important and valuable too. You worked. It was just
I worked.
Yes.
I just didn't work for
Yep.
other people.
Yep.
I worked for my family. But when my son was old enough, we put him in school, and I went back to IDD in case management, and was a manager there, and left the company and built my own company with case management.
Wow, that's impressive.
Mm-hmm.
Let me ask you about case management.
Okay.
What do they do exactly? You know, part of the thing that we want to do here is to help people understand the field and the career opportunities in this field. So what is a case manager?
It's a catch-all word for people who coordinate services. So the case management I did and the case management my company did coordinated all services related to people with IDD. So any service they needed, we made sure they had that service, and we managed the service.
So can you throw out some examples of services?
Residential services, people
Okay,
who
so
live
where
in
they
homes
live.
where they live.
Okay.
Medical services.
So you
specialties.
coordinated like doctor visits
We
and stuff?
did.
Okay.
We coordinated doctor visits. We coordinated specialties if they needed ancillary services like OT, PT, speech and language
Okay.
services. Those any service they needed.
Transportation,
sometimes
work-related services,
Employment.
as well. So, like you said, kind of the catch-all
It's the
for
catch-all.
supports and services, and making sure they get what they need in the right amounts and the right times. And
Absolutely.
sounds simple.
It sounds simple.
I was kidding.
You have to be kidding. Yeah, no, it sounds simple.
Yeah.
It's very complicated.
Oh yeah,
Yes.
very much so.
Absolutely.
Very much so.
So I left the company, built my own company, and stayed there for about 6 years. I was approached by someone at UnitedHealthcare to come and help build the employment community first entity at UnitedHealthcare.
So that's the managed care
That's
part,
the
part of
managed
what
care
you
part
did.
of what I did.
Yeah.
And so I went and worked with some folks and built that program from the ground. And I was at United about 5 years, and then ended up at StationMD.
All right. So we're back to StationMD.
StationMD.
I really like StationMD,
Yeah, me too.
and all of you are my buddies, I have
Thank
to say.
you.
But tell us a little bit about what StationMD does and what's unique about StationMD.
What's unique about StationMD is not just the telehealth piece. We know that's relatively not new, but it's something that we use in our communities. You use it, I use it. But for people with IDD, it's typically not so much utilized. And so what StationMD does is they bring people with IDD into a space that the rest of us already experience with the telehealth. And what
That almost sounds like health equity.
you think? That's exactly what it is.
Yeah.
It's health equity.
Yeah. It's having equitable services for everyone.
Absolutely.
And in order to do that, sometimes you need a little special slant on services, and that's kind of what StationMD provides, right? Is they have some training and experience in providing health care for people with IDD, which makes them pretty unique.
It makes them very unique because we know we have other telehealth entities out there who say they work with the IDD population, and maybe they do, but they don't specialize with their training. And one of the things that StationMD does very well is they stay current on their training, on their IDD training, and they're very open to learning about the IDD population as in depth as they possibly can. So they don't just take a one-time training and consider themselves proficient in that area. They have ongoing training, which is very important.
You know, that's really kind of one of the ways that I became familiar with StationMD is I developed a training course for physicians. Absolutely. And that's their introduction to this field when you bring on new healthcare providers, is they take that course as the beginning. And as you said, I know that you guys do continue
That's right.
with training all along the way, and you train others, and not to mention the experience that you have in providing healthcare to people with disabilities, because you know I certainly needed the experience and I benefited from the experience as well too. So it's more than just a training, but it's a training plus the experience that you have out there. And you guys are in a number of states now, right?
We're in 22 states,
Yeah.
and so it's growing rapidly, and it's growing because of the specialty and the work they do. I have not been anywhere where StationMD has received bad comments. It's all good.
Yeah. It's great to work for a company like that, isn't it?
It is fantastic to work for a company like that.
So what do you do specifically at the company?
Right now, I'm the Senior Director of Waiver and Program Development, and so I work specifically with the waivers in those waiver states in Tennessee and Missouri.
Okay.
So managing that waiver process, which is difficult and it's confusing to work within their processes. And so because I've worked in the waivers for so long, I understand them and can maneuver those states.
You know, you said because you worked in the waivers so long, and I get that because it took me forever to figure out what a waiver was, and I was working in the field for a long time as well too. And for everyone out there, and this is a super simple version of it, but basically, a waiver is where a person qualifies, or there are certain qualifications for someone to be able to receive services inside of a facility.
That's correct.
And what a waiver is it waives the facility requirement, or that the person has to be in the facility to receive those services, and they can actually receive it in the community setting.
Exactly right.
So waivers are the funding mechanism basically through Medicaid that allows people to live in community settings and still receive all of those services. Did I get that right?
That's exactly right.
Okay, good.
Couldn't have said it better.
It took me forever to figure that out.
Couldn't have said it better.
Yeah.
That's
well,
perfect.
thanks. Okay,
Yeah.
good. And that is so valuable to people because, gosh, don't we all want to live in a community setting instead of in a facility if we have the option and the choice?
Absolutely.
Yeah.
And not just in a community setting, but in a community setting, and we talked about equity.
Yeah.
In a community setting like you and I live in a community.
That's exactly right.
Setting.
Yeah, and that's what we're all working towards. Speaking of that, we are coming to you from the AAIDD conference in, where are we? Pittsburgh.
We're in Pittsburgh.
Cool city. First time I've been here.
It is a cool city.
Yeah. AAID is the American Association on Intellectual and Developmental Disabilities. It, I think, is the oldest IDD-related organization, or very close to it. If it's not, we'll find out later. But it's been around for a long time, and does a lot in terms of growing this field and helping people understand it and stay current on it. And a lot of research is done related to this field to help move it forward.
Absolutely.
So great conference if ever you have an interest in coming to it.
It really has been.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So, Carol,
Yes.
it's game time.
Okay.
All right. So I do something called 3 and 3,
Okay.
which means give us 3 things in 3 minutes that you think can improve support services, health, wellness, or any advice, just anything that you want people to know about this field in general that you think would benefit people with IDD.
Okay. All right. So let me start with health and wellness. I feel like we focus a great deal on medical, but what we don't focus on with people with IDD is their self-care. So do you take care of yourself? Do you stop? Do you breathe? Do you walk? Do you do those things that we all do for our self-care? We need to focus on that for people with IDD.
Good point.
2 things. Let's see. I feel like knowledge, I think we never stop learning about people with IDD. So when we think we know it, we need to learn some more.
You know, I love that because I've always said I don't ever want to be an expert. I always want to be becoming an expert.
Always.
Because if I think I'm an expert, I already know it all and I don't need to learn anymore,
That's
right?
exactly
So
right.
I love what you said. Yeah, it's like, you know, when we think we know it, first of all, we probably don't.
Probably don't.
And there's always more to learn.
Always.
Love that.
Always more to learn. And then the third thing, I just think we always need to remember that people with IDD want the same things we have, nothing different.
I could not agree more. They're people first.
They're people.
And people want independence to the best that they can have it. They want to be good, healthy. They want to have friends. They want to have a job. They want to have whatever they need, just like all the rest of us.
Exactly.
Yeah, and when we see them that way, it changes our perspective, I think, in a very positive way for all of humanity.
I agree, or it should.
It should.
Yeah.
That's right. Carol, thank you so much for joining me today and being part of this. But more importantly, thank you for the amazing work that you have done in this field and that you continue to do.
Thank you for having me. Happy to be here.
It was a pleasure.
Thank you.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.